Okay, buckle up everybody because today we are diving into the future of dentistry.
It's going to be a fascinating one.
Yet no, I'm not talking about toothbrushes with Bluetooth, although those do exist. I'm talking about ditching the needles, ditching the pills, and getting treatments straight to where they're needed.
It really is amazing some of the stuff they're doing with drug delivery these days.
It's all thanks to some seriously cutting-edge advancements. Like we've got journal articles here with titles like Advanced Drug Delivery Systems for Local Treatment of the Oral Cavity.
Oh yeah, and applications of novel and nanostructured drug delivery systems for the treatment of oral cavity diseases. We're talking next level stuff here.
Next level is right. So basically, what we're going to unpack today is how this incredible science, this nanotechnology, is going to change the way we treat everything from gum disease to even possibly regrowing teeth.
The future is wild.
Wild is an understatement. But before we get ahead of ourselves, I think it's important to understand why this is such a big deal, right? Like, why is delivering medication in the mouth so complicated in the first place? You would think it would be simple. Just pop a pill or use some mouthwash, but it's not that easy, is it?
Not at all. And the reason is, well, just think about what your mouth goes through on a daily basis.
Okay, true. I mean, we eat, we drink, we talk.
Exactly. You've got saliva constantly washing things away, not to mention all those nooks and crannies where bacteria like to hide out.
Right. Like those bacterial biofilms I was reading about. One of these research articles, I think it was the therapeutic delivery one, they said something like, the oral cavity is a complex environment inhabited by a myriad of diverse microorganisms often existing in resistant biofilms.
Ah, biofilms. Those things are the worst.
I know, it sounds kind of sci-fi, but from what I understand, these biofilms are basically like force fields that bacteria build to protect themselves. Is that right?
That's a really good way to think about it. They're these slimy layers made up of all different kinds of bacteria,
Yeah.
and they make it really hard for traditional treatments to get through. It's like trying to break down a fortress.
Okay, so that's where the nanomaterials come in,
Exactly.
because they're so tiny.
Precisely. We're talking smaller than a wavelength of light. And that means they can actually penetrate those biofilms and deliver medication right where it's needed most.
That's incredible. So instead of just kind of blanketing your whole mouth with medication, hoping some of it sticks, we're talking about targeted delivery at a microscopic level.
You got it.
That's seriously impressive. But how does it actually work? Like, what are these nanomaterials made of? And how do they know where to go?
Well, that's where things get really interesting, and it all comes down to how we design these nanoparticles. We can actually engineer them to have specific properties.
So we're not just talking about like shrinking down the medication to a tiny size. We're talking about actually engineering these particles to do very specific things, right?
Exactly. We can control their size, their shape, even their surface properties, and all of that influences how they interact with the cells and tissues in your mouth.
Wow, it's like giving them a set of instructions or a map to follow.
That's a great way to put it. And not only can we direct them to specific locations, but we can also control how quickly or slowly they release the medication they're carrying.
Okay, so we're talking about that sustained release I was reading about. That seems to be a big part of this whole thing.
Huge. Because it means you can get a longer-lasting effect from a single dose, which has all sorts of benefits. For starters, it means fewer dentist appointments, which I think we can all agree is a good thing.
Fewer needles, fewer pills, fewer appointments. Sign me up. But seriously, what's the impact of that sustained release on, like, actually treating the disease?
Well, for one thing, it helps to maintain a more consistent level of medication at the treatment site, which is crucial for effectively fighting infection and promoting healing.
So instead of those peaks and valleys you get with traditional medication, where it's super strong right after you take it and then wears off, it's more like a steady stream, right?
Exactly. And that can make a huge difference, especially when you're dealing with something like periodontitis, which is a really common but serious gum disease.
Yeah, I was reading that it affects something like 10 to 15% of people worldwide, which is a lot more than I would have thought.
It's a silent epidemic, really. But the good news is that these nanomaterial-based treatments are showing a lot of promise in clinical trials.
So tell me more about that. How are they actually using these nanoparticles to treat something like gum disease?
Well, one approach is to load up the nanoparticles with antibiotics and then deliver them directly to the infected gum pockets.
Okay, so again, it's about that targeted delivery hitting the infection right at its source.
You got it.
Yeah.
And because you're delivering the antibiotics directly to where they're needed, you can use a much lower dose overall.
Which is better for the patient, but also helps to fight antibiotic resistance, right? Because The less we overuse antibiotics, the better.
Exactly. It's a win-win situation.
Yeah.
But it doesn't stop there. This technology also opens up the door for something called multi-drug approaches, which is where things get really exciting.
Multi-drug approaches, like
Hmm.
combining different medications into one treatment.
Precisely. Imagine a single nanoparticle that carries not just antibiotics, but also anti-inflammatory drugs to reduce swelling and pain.
And maybe even something to promote healing, like those growth factors I was reading about.
We're on a roll,
Yeah.
yes. We can actually encapsulate those growth factors, those special proteins that tell your body to heal, within the nanoparticles as well.
So we're talking about a single treatment that tackles the infection, reduces inflammation, and even helps to rebuild lost tissue.
That's the idea. And the really cool part is that we can control the timing of when each drug is released.
Oh, wow, like a timed release capsule, but on a microscopic level.
Exactly. We can design these nanoparticles so that they release the antibiotics first to knock out the infection, and then later they'll release the anti-inflammatory drugs and growth factors to promote healing.
Okay, that is seriously impressive. It's like orchestrating this whole symphony of healing all at a microscopic level.
Mm.
But it gets even crazier, right? Because this technology isn't just limited to treating gum disease. I mean, we've touched on the possibility of regrowing teeth, but there's so much more, isn't there?
Oh, absolutely. And one area that I think has huge potential is in the treatment of oral cancer.
Oral cancer. So how does that work? Are we talking about using nanoparticles to deliver chemotherapy directly to the tumor?
That's one approach, and it has some real advantages over traditional chemotherapy, which, as you know, can cause some pretty nasty side effects. But what's really cool is that they're also developing these things called mucoadhesive patches.
Mucoadhesive patches. Okay, you're going to have to break that down for me.
Basically, imagine a tiny medicated sticker that you can apply directly to the inside of your mouth, right where the tumor is.
Okay, so kind of like a nicotine patch, but for fighting cancer.
Exactly. And because the medication is delivered locally, you get a much higher concentration right where it's needed, which means it can be more effective at killing cancer cells while minimizing damage to healthy tissue.
Wow, that's amazing. And less chance of those horrible side effects you get with chemo, right?
Exactly. It's a game changer for sure. But, what really blows my mind is the potential of this technology to not just treat, but actually prevent oral diseases in the first place.
Okay, now you're just teasing me. Prevent them altogether. How is that even possible?
It's all about this new generation of smart drug delivery systems they're developing. These systems are designed to respond to changes in the oral environment, releasing medication only when and where it's needed.
So they're like little microscopic dentists, constantly monitoring your mouth for any signs of trouble.
You got it. For example, let's say you eat something sugary. We know that creates an acidic environment in your mouth, which can lead to cavities, right?
Right.
Well, imagine a treatment that could detect that change in pH and automatically release a cavity-fighting agent right then and there.
So it's like having a built-in defense system against cavities.
Exactly.
Yeah.
And it doesn't stop there. They're also working on systems that can detect inflammation, infection, even the early signs of oral cancer. The possibilities are really endless.
It's incredible to think about how far we've come from those clunky dentures of the past, I mean, we're talking about a future where we could potentially prevent some of these oral diseases from ever even developing.
I know, right? It's truly amazing to be living in a time where we're making such groundbreaking advancements in healthcare.
I totally agree. This has been such a fascinating deep dive. But before we wrap up, is there anything else our listeners should keep an eye out for in the world of advanced drug delivery? What gets you really excited about the future of all this?
Oh, there's so much happening. But one area I'm really interested in is personalized medicine. Imagine being able to tailor treatments to an individual's unique genetic makeup and oral microbiome.
Wow, yeah, like a custom designed treatment plan just for you.
Precisely. And I think we're going to see more and more of that in the years to come.
So it sounds like the future of dentistry and healthcare in general is looking pretty bright.
Absolutely. And with these incredible advancements in nanotechnology and drug delivery, the possibilities really are limitless.
It really makes you wonder what scientific breakthroughs we'll uncover next, right? Well, on that note, we're going to have to wrap things up. But a huge thank you to you, expert speaker's real name, not said out loud, for joining us on this incredible journey into the future of dentistry.
Thanks for having me. It's always a pleasure to talk about this stuff.
And to our listeners, we hope you learned something new today and that you're as excited about the future of oral health as we are. Until next time, keep brushing, keep flossing, and keep those minds curious.